Hey everybody, it's Dr. Galvin with another post-night shift COVID update. Worked in the ER last night. It's bad. For those of you who don't know, my name is Jeffrey Galvin. I'm a board-certified emergency doctor. I've posted, I think 150, 160 videos, many of them after ER shifts since the beginning of COVID. I try to give an unbiased representation of what is actually going on in the hospitals. I try to provide good data. We've been doing this for a long time. If you like these videos, please, hit the subscribe button for YouTube and follow us on Facebook. It's crazy here. I'm outside of Charlotte, North Carolina. We are just inundated with COVID. We're looking at 18-hour waits in the waiting room. Incredibly frustrating for both patients, staff, and the physicians. We just don't have ability to see people. People are waiting hours and hours and hours because every room in the ER is filled with admitted patients, the majority of whom have COVID. The majority of those people are unimmunized, and it's just one unimmunized person after another coming in really, really sick. Many of them are young. Earlier in the week, we admitted a 13-year-old and an 11-year-old to the children's hospital. The vast majority of people are unimmunized. So please, please, please stop listening to the conspiracy theories. Stop listening to all the people that have never taken care of a COVID patient. Take my advice from a working emergency doctor. Please get immunized. You do not want to get this Delta variant. It's very bad. It's making a lot of people really, really sick. Please take care of yourselves. And, we've given at this point 5.7 billion doses of vaccines. There hasn't been really any problems at all. There hasn't been a single case of antibody-dependent enhancement or any of the other crazy things these anti-vax people are claiming. All we're seeing are the wreckage of people that have been listening to this false information, not getting immunized, and now coming in really, really sick. It's just getting exhausting for all of us. A lot of us are kind of at the end of our ropes, and every time we walk in and hear another story from somebody else who was given all this information and decided not to get immunized and now is really, really sick and now regrets it. All those people regret it. Nobody's saying, well, I'm glad I didn't get immunized. They're all saying, I wish I did. Anyway, don't get me started. I did want to talk about a couple studies because there were 3 studies that came out in the last week or two that I thought were interesting. One in particular, I think, really kind of puts the mask question to bed in some manner speaking. Yale and a couple of the big universities, in conjunction with some universities in India, did a massive randomly controlled trial looking at mask use and risk of COVID in Bangladesh. And it involved 350,000 people, and they took 600 villages, and basically they matched them. In one village, they did a mask intervention. In the other village, they did not. And some of those villages got surgical masks, some of them got cloth masks, but they were always matched with another village that didn't get any masks at all. And they did this study in 8 weeks between November of 2020 and January of 2021. And they not only did they give out the mask, but they actually implemented in those areas that they gave out the masks, they actually implemented an educational program that they called NORM. No-cost masks, offering information through local leaders and celebrities, cricket players, imams, things like that. Regular reminders and modeling by those same people of wearing these masks. And then they put observers into the community to gauge mask use. And what they found was by doing those 4 things, they were able to increase mask usage in these villages where they gave masks out from 13% to 42%. So they actually had pretty significant mask usage, and they were able to clarify that. And what they found in the villages that had the masks were used had an 11% reduction in risk of developing COVID. That went up to 35% reduction risk if you were above 60, compared to the villages that were not masked. Now, this is a randomly controlled trial with a huge sample size, really well designed. We haven't really had a study that really kind of definitively shows that masks really do work. So if you don't believe in masks, I'll put a link to the study in the notes here. Look at it yourself. But this is a well done study. Do I think the anti-masks people are gonna buy it? Of course not. But they're the same ones that are out protesting school board meetings. And then a week later, when school opens, we have a slew of schools closing after COVID outbreaks. So I can only give you the information. I can't make you understand it. The other study was out of the Lancet. This looked at 43,000 hospitalized COVID cases between March and May of last year, or March rather, and May of this year. About 3/4 of those cases were Alpha and the rest were Delta. And what they found was there was a higher hospitalization rate for people that got Delta versus those that got Alpha. And also the people that were getting admitted for Delta were younger too. So they were seeing higher admission rates and younger people. 74% of those admissions were unvaccinated. Another 20-something% had only had one dose, and only 1.8% of those admissions were in people that had been fully vaccinated. So 98% of the COVID admissions in that study out of 43,000 were unvaccinated. So again, another really good indicator that being vaccinated protects you against hospitalization and death, which we've been saying from the beginning. The other neat vaccination story out of England was another study that looked at people that had breakthrough COVID infections. So they were immunized and they had COVID anyway. Their risk of developing, those people that had been vaccinated, they had a breakthrough case. And if you guys don't know, I had a breakthrough case about 2 weeks ago that consisted of a grand total of 1 day of the sniffles. So I'm fully vaccinated. My last vaccination was on January 17th. So I'm kind of probably in that booster window there at almost 9 months. I got exposed to one of my children that was vaccinated as well. She had cold symptoms for 2 or 3 days. She exposed my wife and I, who both had very minimal symptoms. My wife had a little bit longer symptoms than I did. I had a day's worth of sniffles. My wife had about 3 days of myalgias and body aches and a little bit of headache and congestion. That was it. Very, very mild. The worst part of it was having to quarantine for 10 days. But it turns out that if your risk of developing any kind of long-term COVID symptoms from a breakthrough infection is half of that that you would have if you were not vaccinated at all. So 3 studies. I will post links below to all of them. You can read them yourselves. Don't believe me, read them yourself. Don't just read the headlines. Read the studies. Try to understand the studies. If you don't understand the studies, go to some place that can explain it to you. As usual, I'm Dr. Jeffrey Galvin. Please wear your masks, get immunized, take care of yourselves, take care of your families, take care of your communities. I'll talk to you soon. Bye.